about you? Which one?
It was alright. I mean, it kind of stings to get demoted, but our team, we had a good team. Everybody knew where we were with our project.
Now you're going to make that many decisions, you make all the decisions.
Yeah, that stinks. But if it's what's better for our business, it's better.
We're all making the same amount.
We're like team players. We work together on
But
everything.
it's not about money, right? So you're a non-profit, so you make the same amount of money, but it's not about just making money. It's about making the decisions, being in charge, being in control. So wouldn't that kind of impact your motivation? Like, would you still do the same job at the same level, same quality?
Probably not. I'd probably step back a little bit, do a little bit less, but
Did you feel that it was an unfair decision?
it's a spur of the moment decision. But I don't necessarily think it's unfair.
All right. No, you covered Kemal. Okay, so you did a really good job. I didn't feel like you were actually covering for someone else's part. I think that's really good. Now, Kemal, you were not expecting. I think you guys were kind of thinking that I was done with making those changes, right?
Yeah.
So that you weren't
Yeah.
expecting that.
Yeah.
So how did you take that?
About me getting fired?
Mm.
I didn't expect it at all.
Well, but what were you thinking over there?
Well, I'm just glad that my team was able to cover that. We all like knew each other's information because we all worked really good together.
Well, okay, that would be for the cost, but if it was the real life,
Well, real life too. Like she knew all the
but
information.
you're not making any money, you don't have a job anymore.
Oh yeah. I'm not alone.
Who cares what they do? Right? They just fired you. I didn't fire you. She fired you. Because I just placed the order, but she was the one who initiated it. I facilitated the order, but she's the
I
one
guess
who
I gotta sell my
orchestrated it.
big house.
Huh?
Gotta sell my big house, all my cars.
So you won't look for any other job?
Obviously. I have to.
Suppose.
Yeah, I'd call you up.
Don't sell anything. Okay. So who would you fire?
In terms of like the project or like
Well, you are not in charge of them in real life, so of course it's part of the project.
just in there because she had basketball.
Oh, you can blame the basketball.
Well,
has
she
only
wasn't
one
there
class.
as much. It was hard. It was harder to communicate because her practice.
Who would you fire?
I would fire myself too.
You can.
I can't? Oh, okay.
You did a good job. I mean, I don't know how much.
No, because I feel as though if it wasn't for basketball, then I would have been like a lot more involved, which I wanted to be. But basketball, of course, it keeps me from emailing them as soon as I can and whatnot. So I mean, it is tough.
Oh, those are, I don't want to hear.
Okay,
I don't
fire.
hear who you would fire.
Yeah, here.
Kaylin.
Okay. Teresa, did you think that my decision was fair with the CEO and the COO?
Please.
It's yes or no?
No.
Okay. Alright. Kevin, do you think the CEO was doing a good job?
Well, Dana?
Which one? Hey.
Yeah, which one? Okay. Yes.
Yeah, I think Dana did a really good job.
Who would you fire?
Wait, is basketball an excuse?
You can know, you have to pretend that I did not fire this in that. She's a good presenter.
No,
She says,
well, all of us were. That's why it's so hard.
huh?
All of us. That's why it's so
pick
hard.
somebody.
No.
Okay, fire you.
Fire me.
Okay.
Caitlin, she's the only one who hasn't been fired.
Everybody gets fired.
Sorry. Okay, now, what was the biggest challenge for you guys? Other than, you know, not being able to communicate, that's, even in real life, it's
It's a lot
not.
of the budget.
Yeah.
Budget was very,
Yeah.
I mean, me and Kaylin came into this class, Jacinda and Teresa had kind of a little bit of background, but we
And then they were like,
really
what are
weren't
you
a big
guys
help at all,
doing?
Yeah.
so. We started off fresh with this course, so that was probably getting the numbers together and all the logic behind it was probably the hardest.
Yeah, I don't have to agree. I think the budget was definitely the hardest. Anything with numbers, cause it's never the exact same. So you have to change numbers around in order to get it where you want it. And then dealing with Excel and then the formulas, it was
Interesting.
yeah, it was different.
We took Excel, but we didn't really learn.
Yeah.
Melissa, let's start with you. Good questions.
Oh,
You wanna just find someone?
I have a question. For challenge number 2, so going on, you had to fire one of the physicians. You chose to split the patients up between 8 other providers instead of hiring a new physician. Did you think about possibly doing both at the same time? So you would hire one physician and then slowly take those patients from each of those 8 providers?
I mean, eventually, if it got overwhelming for any of the physicians, but if they didn't have like their maximum capacity of like patients they could have, then we would just leave it that and eventually hire another physician as we got more patients.
I didn't see anything about like repairs or maintenance or any kind of like.
they did.
Here's a deal.
Okay, that's right now, okay. That was it. Well, good job, well done. It's my bad.
No electric either.
Yeah, like just.
It was free.
Well, it wasn't free.
Yeah, I think all the trash removal and
We
electric,
included that in the 22.
yeah, I
We
believe
did
we
enter
raised it
repairs
all.
there. I think, being that you have a, nonprofit, what you call this, organization, would you have changed anything as far as your priorities?
Definitely our community first, I mean, especially where we're all throughout Delaware, but Delaware's a small state, we definitely wanna specialize, and since we were specializing in women's health, kind of reach out more to specific community needs, if there's, you know, more populated, there's something going on here, there's pregnancies, or, you know, being there and in the right areas for where people needed what we needed to provide for them.
But I mean, with your priorities, meaning for.
Yes.
Just rather than skip or.
Well, you guys tell me who do you?
Oh.
Alicia.
So, how about you guys?
I said Dana.
So you were just off the CEOs, I should have done that.
Yeah, it's just
Work for
So we got to.
You do us.
I was actually, I used to that. We write our name on it? No? We don't have to write our name on it? No?
Doing what?
No, we have to write our name on it?
Is it unanimous?
Oh, no, I need names. Your mom, I think I could do it.
Your initial is JJ too?
JJ.
Yes.
Yeah, that's right.
Yeah.
What's your middle name?
They,
John Bon Jovi.
I would say no.
Judy B. Jones. I love that those books. Judy B. Jones.
Wait, let me put my name.
Sorry. Judy was fans of it.
That's your signature, that's not your name.
It's gonna be famous one day.
Nice for girls and brown.
Yeah. I was like, we're gonna do it all over again next semester.
Well, now I can give the better idea.
We do.
I didn't put the old one.
Yeah, it was. Because you're good. Because
Can you
when we
imagine?
started this, and I thought that was gonna be the only twist, is you just exchanging our job
I
titles.
know, when she got up, I
Yeah,
was
when
like,
she
you
got
gotta
up,
be
you're
kidding
fired. I'm
me.
like, really?
Oh, you're gonna give us some.
He had some tricks up his sleeve. That's good. That's good. Good thing they go first. I was like, let's go first, let's go first, let's go first.
I know you were all adamant about it, and I was like, we're not gonna go ahead.
Thought you guys beat from the get-go.
Hannah's the one that wanted to go first so bad, so.
Yeah, that was a mistake.
I had a question about, you were saying that malpractice is the third leading cause of death. I was surprised about that. Where did you find that?
On some website, and I don't know how, I could, there's
It's
no
really
reason.
standard.
Yeah, that's why I wanted to put that, cause it's, I mean, it was very, I didn't remember that.
I had
You
to
gotta
send
scare
it to her
your
because I saw it and I was like, put it to the slide.
Don't go anywhere.
Not today.
Not today. Well, not in the next semester.
Probably,
That's what you.
it was like some medical, like, information website.
When you wrote checks.
She has passion.
Delicious.
You and her both.
You're so good.
Good job.
Yes, we can still.
The weekend, we still got this class next day. This is my last class.
It's first Friday.
Oh wait, is there any possible way I could take the final earlier? No, please stop, no, you're gonna have to, my coach is gonna call you, and she's gonna say, we have an away game, she has to be there.
I didn't do it.
My coach. I know, but you don't understand. You
She
don't-
can play in her eyes on the sidelines. Like, she wants her to be there. Isn't it required though, because you're on scholarship?
But wait, why does she have to be there when her
You can take it up with her. Yes. You can take it up with
Yeah,
her.
call her.
You can take it up
You
with
gotta
her.
call her.
Who's that?
My coach. I mean, it doesn't matter. I can take it on the day, but you're just gonna have to tell that. Jordan Court. She. Tell her email you. She's in trouble.
That's different than the Goldey email.
Yeah.
ACL and lateral meniscus. Yeah.
When is the certificate? 28?
29. Dr. X.
That's the suits, the surgeon.
There's another guy in the Bowden said. I was like, who would want to go to a doctor named Bowden said?
There was a really good guy named Axon. He was good, but he retired.
I don't understand how he doesn't know Dr. X. Dr. X.
She does all those surgeries in the
Yes, he.
Access,
I'll wait
good,
Yeah.
That's not
he's
still
well known
recording.
too.
That's how I was just like, especially with somebody like him who doesn't know him.
Yeah.